Have you ever avoided attending office hours because one-on-one conversations with your professor or TA feel terrifying? If that sounds like you, stay tuned. Let's talk about social anxiety in the classroom. In college, it is normal for students to feel a little nervous about their performance. But when anxiety becomes disruptive and starts affecting your everyday thinking, behavior, or emotions, that's when it becomes a real problem. According to the Anxiety and Depression Association of America, social anxiety, also called social phobia, is the intense fear of being judged, negatively evaluated, or rejected in social or performance situations. It's actually the most common anxiety disorder. It usually starts young, by age 11 for about half of people, and by age 20 for around 80%. And according to a 2023 Healthy Mind study, nearly 37% of college students in the US reported experiencing anxiety on a daily basis. So, what does social anxiety look like in a college setting? It can mean feeling anxious when speaking in class, skipping class to avoid participating, avoiding eye contact, experiencing physical symptoms like a rapid heartbeat, sweating, nausea, or even panic attacks, skipping office hours because you're scared of being judged, or staying away from clubs and organizations to avoid social interactions. These symptoms can lead to lower GPAs, missed opportunities, and lower self-esteem and confidence. Like many mental health disorders, social anxiety has multiple causes. According to the Mayo Clinic and Harvard Health, genetics may play a role because anxiety can run in families. The amygdala, a brain structure that manages fear, might also be overactive. Environmental factors, like being bullied or having overprotective parents, can also contribute. Also, low serotonin levels, which is a hormone that affects mood, may be involved. Some risk factors include a family history of anxiety, negative past experiences like trauma or teasing, shy or withdrawn temperaments in childhood, and new social pressures such as making a presentation or joining a new club. The good news is that there are evidence-based treatments that can help. Cognitive behavior therapy, or CBT, is the most researched therapy for social anxiety. It helps people challenge anxious thoughts and gradually face their fears in small, manageable steps. This is called exposure therapy or systemic desensitization. Doctors may also prescribe SSRIs or SNRIs, which are medications that help regulate chemicals like serotonin to reduce anxiety. But what if therapy isn't accessible to you? Start by checking your campus resources. At UMD, for example, students can access the Counseling Center for Therapy or Confidence Building Groups, free meditation sessions at the University Health Center, and accommodations through the Accessibility and Disability Service if the anxiety is affecting your academics. You can also practice mindfulness because this means staying present without judgment, treating your sleep problems because poor sleep worsens anxiety, exercising regularly, especially doing cardio, cutting back on caffeine and alcohol because both of them can make your symptoms worse, and considering joining a support group. The Anxiety and Depression Association of America lists both virtual and in-person groups for people with social anxiety on their website, so feel free to check it out. Social anxiety can be isolating, but you're not alone because support is out there. Take that first small step, even if it is just learning more, and give yourself grace as you grow.